We are in the second half of the measurement year, and by now, most health plans have already made major investments. The vendors have been selected, the AI platforms have been implemented, the retrieval teams are working, the abstractors or clinical evidence review teams are reviewing charts, provider outreach is already underway. Now, imagine your CEO walks into your office today and he or she says, you can improve only one operational process before the end of the measurement year. Just one. You cannot hire more people. You can't buy another AI platform. You cannot increase your budget. You can only improve just one process. Which process do you choose? Most executives answer that question immediately. I would improve chart retrieval. I would improve abstraction or evidence review. I would improve provider engagement. I will improve quality assurance. And maybe those are sincere, valid, response. But I think most health plans answer that questions too quickly, because the best answer isn't the process that is causing the most frustration for you. It isn't the department that is making the most noise in your system. And it isn't necessarily the process with the most defects. It is the process that is limiting the performance of the entire system. So last episode, I argued that healthcare quality has borrowed from clinical science, data science, and now artificial intelligence. But we've largely ignored decades of operation science. So for today, I want to introduce one manufacturing principle that I believe explains why two health plans with the same measures, similar vendors, similar technology, and similar budgets can finish the year with very different results. And it's not because one team worked harder, not because one team had smarter people, but because one health plan identified the operational constraints that was limiting everything else. The other health plan did not. And once you understand this principle, you would start looking at your quality operations completely different. Not as a separate department, not as chart retrieval or abstractions or evidence review or QA team, but as a one connected production system. And in every production system, there is always one process determining the speed of everything else. So today's question is very simple. Do you know what yours is? So let's take a step back. Forget about healthcare for a moment. We'll come back to healthcare quality. So imagine you are walking through an automobile manufacturing plant and every system is working. The metals are being stamped, doors are being installed, cars are being painted, engines are being assembled, final inspections are happening. At a first glance, the factory looks very busy. Everyone is working, the machines are running, inventory is moving. But the plant manager will not be asking which department is working the hardest. I believe the plant manager will ask something completely different. And the question will be, what is limiting the number of cars leaving this factory today? Because that is the only question that really matters at the end of the day. Now, let's come back to healthcare quality, right? Replace the car with evidence. A member is identified, the chart or the evidence is requested, the provider responds, or your data aggregators respond, or your data sources platform, they respond. The medical record or the CCD is received. The evidence gets to be processed. The chart is abstracted or the evidence is reviewed. QA team validates the findings. The evidence gets submitted. Every one of those steps depends on the system before it. That is not 8 separate operations. It is one production system. And the throughput of that system is never determined by its fastest process. It is determined by its slowest one. So here's where I think many organizations make a costly mistake. When something feels slow, we try to, by default, make everything else faster. We buy new technology, we hire more staff, we add another vendor, we build another dashboard, we improve multiple departments simultaneously. And sometimes all of those investments are good. But there is one question that often gets overlooked. And the question is, will improving this process actually increase the amount of audit-ready evidence our health plan produces? Because if the answer is no, you've improved a process without improving the system. And this is where operation science changes the conversations entirely. So lean will teach you how to eliminate waste in a process in a system. Six Sigma teaches us how to reduce variations in a system or in a process. Both are incredibly valuable, but before either one can create a meaningful organizational impact, there is another question that has to be answered. And the question is, where is the constraint? Because if you remove waste from a process that is limiting throughput, you've just created a more efficient non-bottleneck. On the other hand, if you reduce variation in a process that is limiting throughput, you've just created a more consistent non-bottleneck. The overall performance of the organization changes very little. The greatest return on investment doesn't come from improving everything. It comes from identifying the one process that is quietly controlling the speed of the entire operations. And that is the process executives should be obsessed with. So, how do you know where your constraint is? I'm going to walk you through it. Most organizations start by asking people, what is slowing you down? And that is a very sincere and a useful question, but I don't think it's enough. Because every department believes they are the bottleneck. Retrieval will say, if providers respond faster, we will be fine. The abstractors or evidence review team will say, if retrieval sent us more charts, we will move faster. The QA team says too many defects are coming through. The same way IT says the technology isn't integrated. So everyone sees the system from where they sit. Executives can't. They have to see the entire system. So here's a simple test. Walk through your evidence production process from beginning to the end, right? And I'm not talking about your organizational chart. I'm referring your workflow. And ask yourself these three questions. The first question is this: where is work waiting? Right? Where is work waiting? Are charts waiting to be abstracted? Are abstraction requests waiting for medical records? Is QA waiting for completed reviews? The Q's tells a story. Work doesn't pile up by accident. It piles up because something downstream can't keep up. The second question you should ask yourself is, where are people waiting? This is different. If your abstractors are waiting for charts, abstraction probably isn't your constraint. If your QA team is waiting for completed abstractions, then QA probably isn't your constraint. The process waiting for work is rarely the bottleneck. The process everyone else is waiting on usually is. Third, ask one question that I think every executive team should be discussing this time of the year. If I could make one process twice as fast tomorrow, which improvement would increase the amount of audit-ready evidence we produce by the end of the measurement year? And this is not about activity, not about productivity. It is all about audit-ready evidence, because that is the outcome we are actually trying to improve. So notice something. I never asked which department has the most people. I never asked which vendor caused the most. I never asked where the loudest complaints are coming from. And those questions, they measure efforts, but they don't measure leverage. And executive leadership is all about leverage. One of the reasons I wanted to record this episode is because we are at a unique point in the measurement year. And the decisions you make over the next few months matter more than the decisions you made back in January. Because by now, your resources are largely fixed. Your timelines are fixed. Your provider network isn't going to suddenly become more responsive. You don't have the luxury of improving everything. And that is why leverage matters. And if I was sitting in your quality operations meeting next week, I wouldn't start by asking another dashboard. I wouldn't start by asking who is behind the schedule. And I wouldn't start by asking which department needs more people. I would ask one simple question. And the question is, what is the one operational constraint that is limiting the amount of audit-ready evidence we can produce before the end of the measurement year? Then I would keep asking questions until the room agreed on the answer. Because once you identify the true constraints, everything else changes. Your investments become more focused. Your priorities become clearer. Your technology decisions become easier. Your AI strategy becomes more disciplined. So instead of asking, where can we use AI? You start asking, will AI improve the process that is limiting our operations today? That is the question you should ask. And those are very different questions. In the last episode, I encouraged quality leaders to borrow ideas from manufacturing. And this week, I want to introduce the first one. And it's not because healthcare should become manufacturing, but because operational excellence follows principles that don't care what industry you are in. Every system has a constraint. Every constraint limits throughputs. And every executive has a choice to make. So spend the rest of the year improving everything, or identify one improvement that changes the ball game. Because at the end of the measurement year, the organizations, the health plans that perform the best will not necessarily be the ones that work the hardest. They will be the ones that improved the right thing. Well, I'm Peter Saah. Thank you for listening or watching. I will see you in the next episode. Have a good one.